Greater National Advocates.
We understand how difficult it can be when a health condition becomes a medical crisis. An unexpected injury or diagnosis can leave patients and their loved ones powerless and afraid. When bureaucratic red tape and institutional failures get in the way of proper medical attention, the entire system falls apart. This is where we come in. Our healthcare system is crowded, complicated, and intimidating. There are obstacles and barriers around every corner. Even if you happen to work in medicine or insurance, it can be overwhelming. We provide immediate access to highly skilled, independent patient advocates who know how to assess healthcare problems, take charge, and solve them. These advocates are trained to step in and manage the uncertainty of a medical crisis when friends and family just aren't enough. If you're like most people, you've probably never heard of a patient advocate. You might be wondering, what exactly is a patient advocate, or what can they do for you? That's exactly what I'm about to go over now. The first thing you should know is that our network is made up of private, independent advocates. This means they are not employed by hospitals, insurance companies, or even by Greater National Advocates. These are independent professionals who work for patients and their loved ones, and no one else. You should also know that each advocate has a particular specialty that's based on their own individual training and experience. Many are former nurses, doctors, social workers, and case managers. Others worked for insurance companies or as caregivers for their own family members. A growing number of independent patient advocates have been tested, credentialed, and certified by the Patient Advocacy Certification Board. The one thing to remember is that every professional healthcare advocate has a specific and unique specialty they can help you with. At Greater National Advocates, we've researched and identified the most common healthcare roadblocks faced by patients and loved ones, allowing us to break down independent healthcare advocacy services into 5 categories. The 5 categories are medical guidance, decision-making support, insurance and billing, recovery and wellness, and helping hand assistance. Now, it's easier than ever to find and choose the right independent healthcare advocate to meet your particular needs. For more information about how to select an advocate that's right for you, please click on the categories below.